My name is Daniel Bianco. I'm a physical therapist assistant. I've worked at Del Webb Memorial Hospital for about 4 years now, and my specialty is orthopedics. I've been using the SecureTrack for about 2 years now. We use it completely on total knee replacements and hip replacements, our elective surgeries, and we use the SecureTrack twice a day, and that's to help get the patients heal faster, quicker. The idea behind the SecureTrack is that it helps put weight through your legs. So if we're able to get you up sooner or get you up twice a day using this device, it's again going to force you to put more weight through the leg twice a day, which in turn is going to make the bone grow, which in turn is going to make you heal faster, which in turn is going to get you off the walker faster, okay? Rather than if you were to use the walker, going from point A to point B, using the arms more and hesitating to put weight through that hurt leg. So this definitely helps with that. The advantage of the SecureTracks to me as a therapist is it allows me to stand any distance away to be able to analyze a person's gait pattern and then tell them what needs to be corrected. That's a big benefit of mine. Also, the device also challenges some of our patients' dynamic balance. And you need balance. Balance is required to go to a cane. So the sooner your dynamic balance is tuned up, the sooner you're going to be able to get to that cane. Another good advantage is if there's a real poor imbalance with the therapist to the patient, say for example you have a 400-pound patient and a 100-pound therapist, and how they're supposed to manage a person like that. If that patient or if that therapist were to try and walk that patient by themselves, it'd be very challenging. If they were to get the patient in the SecureTrack, they could then step away, allow the track to take all the weight of that patient, and then allow that patient to ambulate without any risk of that patient hurting them, and prolonging their career as well. And also needing 2 people to help ambulate a patient as well. The SecureTracks allows at least just 1 therapist, so you're freeing up another therapist to get more therapy done in the hospital. Another good thing about the SecureTrack is that it's not stuck in some closet somewhere down in some hall. Whenever you walk into the gym, it's always available. It's either conveniently up in the ceiling or another person's using it and then it's your turn next. Rather than having to go and grab a standing frame or going to grab some other type of a device that's tucked away. This is right here, right now. You could use it, get it going. You can get your day more timely and work on that time management. This is the SecureTrack here, okay? We're going to be using this to ambulate some of our patients. It makes the ambulation a bit easier, helps them put weight through their legs. It's going to challenge their balance a little bit so we can get them off the walker sooner. It's also conveniently stored here in the ceiling for our use for when we need it, okay? So what we're going to do is go ahead and pull the machine down. We're going to be using the strap here to do that, and we're going to do that until it clasps into place. Okay. We're going to come around to the side, so let the arms down, and we're going to do that by pulling out this pin here and locking it and pulling it straight back down. Okay. And then we're going to lock it right back in place. So the device now needs to be set up for a patient's height. What we're going to do is come around to this plunger here, okay? We're going to push down on it. When we push on that and pull down, it's going to allow us to adjust for the patient's height here, okay? Ideally, you want to put this in the patient about 2 inches or at least 2 finger underneath the armpit. This way we're not putting too much pressure underneath the brachial plexus. And we're going to lower this just a bit. So when the device is ready for the patient's height, now we have to prepare for the patient's width. What we're going to do for this is come to this lever here, we're going to pull it down, and then we're going to crank for this to be open. Again, to help accommodate the patient's width. Once the patient's in the device, and I'll act as patient, we're going to pull the device up to our back until the pad hits our back. We're going to open up the hand grips, all right? And we're going to make sure these pads are underneath our armpits. Once the patient's nice and secure inside the device, what we now need to do is the very last piece, which is make it completely secure by using the belts and locking those in. The patient's now ready to go. They can put all of their weight into the device. If they fall, it's going to catch them, and then they can start just moving forward and begin gait training. Okay? As a therapist, I'm able to stand 15, 20 feet away, 30 feet away if I'd like, to help gait train these patients. So now we're going to go ahead and take the patient out of the device. Okay, we're going to start again. We're just going to do everything in reverse. We're going to take out the buckles, let it go back. Okay, we're going to open this up so it doesn't hold the patient away, hold the patient back, and then we're going to go ahead and put the walker in front of the patient and then let the patient walk away. The therapist is going to come back and put the device away, back in the safe, convenient location. So we're going to place everything right back in reverse, just like so. Okay. And then we'll pull this up, click it back in, making sure it's locked. Then we're going to come to the plunger again, pull it back into the case here. You want this column completely in there so it stays properly. And then we're going to come to the front of the device. We'll also make it tidy. We're going to come to the front of the device by pulling at the base, pushing at the pad to help wait for it to clasp, and then it'll bring itself right back up like that. And now it's stored away until the next person to use it. And that's the SecureTrack device.